Welcome. My name is Mary Ellen McMahon, and I am a graduate student from Kaiser University. Today I am here to introduce my presentation of Understanding Insomnia Disorder. While many individuals lay their heads on a pillow at night and awake in the morning refreshed and ready to face a new day, there are others who are not so lucky. These individuals may find that sleep is an elusive dream. While an occasional sleepless night may be simply bothersome, a chronic pattern of sleep disturbances, such as insomnia disorder, can not only affect one's daily functioning, but can have a serious impact on one's physical health and mental well-being. Therefore, as sleep is an integral part of an individual's health, it is important to study the risk factors that lead to the development and maintenance of sleep disorders. Today's presentation will take a biopsychosocial approach to understanding the risk factors inherent in a specific sleep disorder known as insomnia disorder. The topics we will cover today include an introduction to the biopsychosocial model of health, an overview of sleep disorders, including the classification and the possible health impacts sleep disturbances can have on one's health. Then we will examine the prevalence of insomnia disorder and the criteria that must be met to reach a diagnosis of insomnia as a primary condition. Then we will look at the biological, psychological, and sociological risk factors that lead to the development and maintenance of insomnia disorder. Models of health help medical and psychological professionals approach an understanding of the underlying causes or etiology of illness or disease. Such models provide information that leads to the development of treatment for health conditions. Medical professionals often utilize the biomedical health model, which provides an understanding of the etiology from a physical perspective. In other words, if illness or disease is present, then the biomedical model considers it a result of a physiological malfunction within the body. Dr. George Engel felt this approach failed to take into consideration other factors that contributed to illness or disease, such as health behaviors. Dr. Engel addressed this problem by developing what is known as the biopsychosocial model of health. Dr. Engel believed that the biopsychosocial model of health provided a more integrated approach in that it examined the biological, psychological, and sociological factors that can lead to illness or disease, and also addressed the problems of everyday living in connection with such conditions. By encouraging professionals and researchers from different disciplines to consider all variables that could affect or contribute to illness or disease, Engel's model has provided a more comprehensive understanding of the etiology of health conditions and has become a major element in the field of health psychology. Now let us look at an overview of sleep disorders, as insomnia disorder falls within its domain. Sleep disorders, also known as sleep-wake disorders, refer to interruptions in sleep which result in an individual experiencing dissatisfaction with the quality, timing, and amount of sleep, and that leads to daytime distress or impaired functioning in everyday living activities. For example, if an individual experiences chronic sleep disturbance, they may feel drowsy during the day, which can affect their work or driving skills. There are 10 specific disorders or disorder groups that fall within the scope of sleep disorders. As you can see, the classification of sleep disorders includes such conditions as narcolepsy, rapid eye movement disorders, restless leg syndrome, and sleep disorders induced by medications or drug use. Any one of these disorders can lead to serious impacts on one's physical and mental health. Research has indicated that sleep disorders can occur at any age. From young children to the elderly, such sleep disorders can contribute to such serious health conditions as cardiovascular disease, obesity, diabetes, depression, and impaired cognitive memory and learning functions. Now let us move on to learn about the most common type of sleep disorder known as insomnia disorder. Insomnia symptoms, such as interruptions in sleep, occur in about 1/3 of the general population. It is more prevalent in females and is often found to exist within other mental disorders, such as depression. However, only 6 to 10% of the population who experience insomnia symptoms will meet the criteria for a diagnosis of insomnia disorder. The diagnostic criteria set forth for insomnia disorder mandates that the sleep disturbances must cause dissatisfaction with the amount or quality of sleep an individual receives. The sleep disturbances experienced must take the form of difficulty in initiating or maintaining sleep, or waking early in the morning and being unable to return to sleep. Sleep disruptions must be clinically significant and impair the individual's ability to function in their everyday life, such as work or driving. Sleep disturbances must also be chronic, in that they must occur at least 3 times a week over a 3-month period. Sleep disturbances that are not considered primary insomnia disorder include disturbances that occur due to a lack of opportunity to sleep, disturbances caused by the presence of another sleep disorder, for example, sleep apnea, or because of medications or drug use. There have been numerous biological risk factors that can contribute to the onset or maintenance of insomnia disorder. One biological risk factor comes in the form of genetics or heredity. Although, through Phalian twin studies, a genetic influence has been found to contribute to the likelihood of developing or maintaining insomnia disorder, the specific genes have yet to be identified. Further research is needed to provide information on which specific genes may contribute to the inheritability or likelihood that a future generation may fall victim to insomnia disorder. Other biological risk factors that have been identified as underlying causes of insomnia disorder include age and gender. Hyperarousal is considered a high risk for insomnia disorder in that it involves a high activation of both physical and mental processes. For example, a racing mind or feeling jumpy can be indicators of hyperarousal. Depending on one's age, the risk of hyperarousal can increase or decrease, such as hyperarousal has been shown to decrease as one ages. As mentioned before, sleep disorders are more prevalent in women than in men. This holds true for insomnia disorder. Women are 1.5 times more likely to incur insomnia disorder through experiences such as menopause or motherhood. Certain psychological risk factors have also been found to contribute to the likelihood of an individual developing or maintaining insomnia disorder. Sleep cognitive arousal refers to the mental stimulation that can occur prior to falling asleep. Stress is a common factor in stimulating sleep cognitive arousal. For an example, an individual may continue to worry about work or family problems, and these thoughts can continue to stimulate the mind while the individual tries to fall asleep. Sleep reactivity refers to the degree that individuals allow stress or other factors to influence their sleep. Some individuals may decide to put their worries aside until tomorrow, while others may dwell on the stressful events of the day and engage in ruminating thoughts that will impact their sleep. Another sleep cognitive arousal factor lies in the individual's beliefs about sleep. An individual may perceive their sleep patterns as faulty when in actuality they sleep an uninterrupted 8 to 10 hours each evening. These misperceptions can lead to maladaptive sleep behaviors, such as drinking before sleep or taking a daytime nap. Emotional arousal caused by negative emotions or undue attention to environmental stimuli, such as noises outside the window, can also stimulate cognitive arousal processes. In addition to biological and psychological risk factors, certain sociological risks can be found within the etiology of insomnia disorder. A low level of education may contribute to a lack of knowledge about good health practices and healthy lifestyle behaviors. The stress of living on a fixed or low income or life crisis such as divorce or separation have also been indicated as risk factors in insomnia disorder. The neighborhood that an individual resides in can also be a risk factor. Living in deteriorating or unsafe neighborhoods can lead to a lower sense of safety, low social cohesion with community members, which can lead to feelings of isolation or an inability to form social relationships. Increased worries about who will help when an emergency rises can also impact insomnia symptoms. Dysfunctional family relationships can impact one's sleep through family strain and a lack of support from family members when dealing with life crises. Risk of insomnia symptoms increases with frequency of contact with contentious family members. Sleep can be impacted when individuals feel that they cannot rely on family members for assistance in dealing with their problems or in venting their feelings about situations in their life. Losing a night's sleep can happen to anyone. However, as chronic sleep disorders can have serious consequences on an individual's everyday functioning, physical health, and psychological well-being, it is important to examine the underlying causes that can lead to such sleep conditions. This presentation has provided a biopsychosocial view of the risk factors that lead to the onset or maintenance of insomnia disorder. By examining the biological, psychological, and sociological risks of insomnia disorder, I hope this presentation has expanded your knowledge of how insomnia disorder develops or can become a chronic condition. I wish you all a good night's sleep. You have reached the end of our presentation. Thank you for your attention.